All right, let's review the quiz real quick. So my first patient is Anna, who's my 12-year-old. She is post-op from a leg fracture. Her vital signs are as follows. So she's getting a 0 for airway. She's getting a 0 for breathing. Her heart rate is a little elevated for adolescents. She should max at 100. She's 110, but her pain's an 8. So you can score her a 0 and account it by pain, or you can score her a 1. Either one's fine. Disability is a 0. I'm not concerned. Mom's not concerned. Spews score is either a 0 or a 1, which gives her a level of low. I'm not really concerned about her heart rate because I think it's probably due to the pain. I'm going to give her some pain meds, and I'm going to see how that does for her. She would be a Q4 reassessment because she's a low. Nothing here in that scenario is making me think I want to call the doctor. So I'm just going to keep an eye on her. Next we have Miss Izzy. So her previous spews score was 3. She is febrile, and her vital signs are a little out of the normal range. So her heart rate is about 8 beats over where she should be as an infant, and her respiratory rate is a little elevated as well. So she should max at about 53, and she is 64. So her previous airway score was 1, but she's actually going to be a 2 because she has a couple things going on. She is requiring nebs every 2 hours, and she is wheezing pretty significantly. So that's going to score her 2. Breathing, she scores a 2 for a couple different reasons. She scores a 2 because she's needing oxygen, so up to 50%. So actually she would be a 1 based on her oxygen, but she's a 2 because she's retracting in more than one location, and her respiratory rate is elevated as well. So she should be up to 53. So she's up a little bit, but it's really because of her retracting in a couple different places that moves her to the 2. So she's a 2 there, which she's been. Circulation, you could count it because of the tachycardia, but I'm going to attribute that to fever. She's only a little bit above where she should be, and her temperature is 102. So either one is correct, but you could attribute it to fever. Disability, she is fussy and sleepy, so she's going to score a 1 for disability. I'm not super concerned. Mom's not super concerned. That's going to give her a spews score of 5. So based on this score, I'm going to see if I can do something about her fever. I'm going to see if I can go ahead and give her some more albuterol. She should be a Q2 reassessment because she's a moderate. So while she's a moderate, we need to be keeping an eye on them and doing spews scores and vitals every 2. And I will call the provider for 2 different reasons. One, I have an increase of 2. So anytime you have an increase of 2 from the previous, regardless of where that score hits, you should call. And if you have an increase at all in that moderate range, or that you should notify the doctor. So if she stayed a 3, I wouldn't, but since she's increased from that 3 and is getting sicker despite whatever interventions we have in place, we will. All right, scenario number 3, David, our TNA. He gets a 1 for airway because he is got some stridor with activity. He's got a 0 for breathing, for circulation, for disability, for staff concern, family concern, which gives him a spews score of 1, a spews score level of low. So based on the score, there's not really anything extra I'm going to do because he is still low. I'm just going to watch that stridor and make sure it doesn't get worse. He will still be a Q4 spews reassessment, although as a fresh post-op, he will be a Q1 vital sign. That doesn't change. I'm not necessarily going to call the provider, although if that stridor does not improve within the first hour or so, I will notify the provider and see if we want to get some interventions in place. Last question is Mr. Colton. So he gets a 0 for airway because he's not retracting nasal flaring, maintaining his airway. He gets a 0 for breathing. Nothing's wrong there. His vital signs are okay. You notice they're kind of right on the borderline there. He does get a 1 for circulation, and that's because he is mottled on the extremities. If he was mottled centrally or blue or gray centrally, he would actually be a 2 or 3, but he just has cool mottled extremities, so he's going to score a 1 there. Disability, he seems pretty alert, although he is exhausted, so he's definitely going to be one I'm going to watch. I'm not concerned. Family's not concerned. His spews score is 1, which will give him a level of low. So my intervention, if you read the thing, you're going to notify the provider if he doesn't improve with warming. So I'm going to wrap him in some warm blankets and see if that improves his mottled central and make sure that he is still appropriately awake. He will be a Q4 reassessment, although I'm going to recheck that modeling within an hour or so. At this point, I'm not calling the provider. I'm not too surprised he's mottled after being unwrapped, and I'm not really surprised that he's exhausted after all those IV sticks. So I'm just going to keep an eye on him.